Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thanks for joining us for another segment. Going to be speaking with Mr. Tom Koulopoulos. He's chairman and founder of Delphi Group, and he's joining us to talk about his brand new book, Reimagining Healthcare, how the Smartsourcing revolution will drive the future of healthcare and refocus it on what matters most, the patient. Matter of fact, is published just this year, May of 2020. Welcome to the program, Mr. Tom Koulopoulos. Thanks for taking the time.
Neil, thank you. It's a pleasure to be here.
Chairman and founder of Delphi Group, give us a brief background about your area of expertise and talk about your role there at Delphi.
Sure. Delphi has focused for the last 30 years at what we call the intersection of business and technology. What we do at the end of the day is try to figure out how leading-edge technologies affect not just our businesses, but our behaviors as well. And much of what we do is trying to understand where business is going and where, as a society, we are going as a result of a lot of new technologies.
You say, where are we going? We were going in a certain direction, and then this COVID-19 pandemic changed the face of society. Our behaviors, you mentioned how it's changing our behaviors, our expectations of business and healthcare in general. Is this an opportunity for new solutions, new resources, new industries?
So, so everything you said is absolutely correct. We were derailed. I call it being evicted from the past, right? We were forcibly evicted from our comfort zone. But when we talk about technology and when we look at it in healthcare, it's not necessarily new technologies. It's technologies that were there that needed an excuse to be brought to the forefront or brought up to the surface. So, give you an example. Telemedicine. Telemedicine is not new. We're all using Zoom and using video conferencing right now. There's nothing new about that. But integrating it into medicine and using it as a convenience and as a way to deliver more effective medicine, that certainly has seen amplification. So I think a lot of latent technologies that were already there, Neil, are now being brought to the surface.
Another thing about this pandemic is that it's showing us that some of the things that we held so dear weren't nearly as necessary to efficient healthcare and or business as we thought that they were.
Isn't that the truth? One of the things about COVID-19, which I think has struck all of us with an enormous impact, is the dedication of clinicians, of these frontline healthcare workers. When they are able to do what they do best, they literally perform magic. What they have done, what they continue to do, is extraordinary. What they are burdened by, however, typically is the administrative part of healthcare. If you can somehow take that out of the equation and allow the clinician to do what he or she does best, healthcare performs incredibly well. But that administrative burden is what costs so much today in healthcare, and it's what drags down the clinician, the physician, and keeps them away from what they want to be doing, which is caring for the patient.
What is it other than administrative red tape that causes this healthcare glitch when it comes to efficiency and patient outcomes and experience overall?
Well, let me give you a very simple example is the electronic medical record, the EMR. These things were originally built to help with billing, to help with the insurance process and the claims process. They weren't built for the clinician. So today, if I walk into my doctor's office and my doctor diagnoses me with a condition, he or she has to go through literally thousands of codes to figure out how to update my EMR. So they're focusing on the process of billing, not on the process of care. And at the end of the day, the billing has to happen, but it shouldn't be the clinician doing it. It shouldn't be the hospital, the provider that's burdened with that. So I think that when we talk about administration, it casts a very broad shadow. And even things like the electronic medical record, which should be there to help create more continuity of care for me as a patient, end up being a burden because they weren't intended to help with health care. They were intended to help with billing.
Reimagining healthcare, how the Smartsourcing revolution will drive the future of healthcare and refocus it on what matters most, the patient. When you're talking about billing, ultimately, it's the patient who's paying that bill. I don't care about codes, insurance companies. We're the ones who are paying the premiums, who are paying the insurance companies, who are paying the clinicians. So we should be at the forefront, at the front of mind on the billing end and the patient experience end. How is that not the case, and how is your book bringing those two together?
Well, part of what I point out in the book, Neil, is that we have created a billing system that is there to game the system. So providers and insurers, not maliciously, but they're being forced to game the system. I'll give you one statistic here that speaks volumes for why that's the case. Denied claims on a yearly basis come to about $260 billion. Those are denied claims, claims that are not paid. I challenge you to find any industry where the amount of invoicing denied is equal to more than 3 times the profit of the industry. So 260 billion is about 3.5 times the profit of all hospitals. It's an absurd number, and it points to the fact that what we've created is a system here which needs to be gamed, and we have to step away from that. And this isn't just about policy and politics, by the way. It's about getting down to the specifics of how these processes are conducted and why in the world hospitals are being forced to game the system the way that they are.
You say it's not politics, but healthcare business, it is politics. It's an election year, and we're going to hear about what we've been hearing about in any election year: single payer models, a national healthcare system, healthcare for all. Are there options where the doctors themselves have a bit of control about their care of their patients?
So doctors are, I think, the one of the crucibles of healthcare. So much falls into their lap. A Mayo Clinic study done not too long ago showed that 54% of all doctors self-reported burnout. They are overwhelmed with processes and, as a result, distracted from the care of the patient. Look, going back to what you said just a few minutes ago, politics will always be part of this. The point that I make in the book is that there are ways that we can begin to solve the problem without getting wrapped around the political axle. So, I mean, today, healthcare is 20% of our economy. And a great way for your listeners to think about that number is that the last 2 digits of our year, so 2020, 2025, represent the percent of the economy that will be attributable to healthcare going forward. So by 2100, 100% of our economy will be healthcare, which is an absurd trajectory, right? And by the way, national healthcare systems will not solve that problem because every country on the face of the planet is dealing with the same fundamental issue, which is that as we grow older, we have comorbidities, we have more healthcare complexity. We saw this with COVID. The oldest part of the population is the most vulnerable. That will not change. And I project in the book that every national healthcare system will suffer the same fate within the next 20 to 30 years because of this aging demographic. So we have to fundamentally change the healthcare process, not just the policy around it, but the process itself.
How do you craft effective change without the government's input or lack thereof?
Right. So far there have been 3 players in healthcare, right? The government, the insurer, and the provider. And what I suggest in the book is something that every other industry on the planet has done right now, which is create another participant in that, an intermediary that you can use to smart source all of the administrative aspects of healthcare too. And we're seeing this done in the book. I talked about John Muir Health in Northern California provider system that has gone to great lengths, very successful, by the way, but they've nonetheless gone to great lengths to smart source all their administrative operations, their information technology, their patient administration, patient management. And by doing that, it's incredible how well they've been able to focus on the care of the patient. So it's being done, it can be done, and smart sourcing, I think, is one of the solutions that's sort of been hidden in plain sight for very long in so many other industries.
What do clinicians need to do in order to have their voices heard? Because we need to turn so-called healthcare into actual healthcare.
Right. Yeah. So caring for the patient is ultimately what every clinician signs up to do. It's why he or she decides to be in the field of medicine. To answer your question, I think what clinicians need to do is take the opportunity now, while we're in the midst of COVID and in the aftermath of COVID, to make their voices known, to make it clear that the best possible care is only provided when the burden of administration is taken from them and they're given the luxury to do what physicians have always done best, which is to build a relationship with the patient. By the way, this does boil down to dollars and cents. A patient with a PCP, a primary care provider, will cost the healthcare system 30% less on a yearly basis than one without a PCP. Mm-hmm. So 30% of the healthcare inefficiency in most patient relationships is due to that administrative burden and not having a PCP to help you navigate the specialist and all of the processes that a patient is subject to in healthcare. So that PCP is critical. But, we can't graduate enough of these PCPs, so we have to give them more space, more license to do what they do well.
Reimagining Healthcare, how the Smartsourcing revolution will drive the future of healthcare and refocus it on what matters most, the patient. Post Hill Press, published just this year, May of 2020. Tom, where can we get copies of your book? I'm sure at all of the usual outlets. And give us a website where we can learn more about you as well.
Absolutely. The book is available in all your favorite booksellers online or offline. You can find out more about me at my website, tkspeaks.com.
Tom, thank you for joining us here on Health Professional Radio.
Neil, it was my pleasure. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Tom Koulopoulos, chairman and founder of Delphi Group. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.